Ms. Boland. This is my final shoulder evaluation. My dad's going to help me today. I'm going to first start by testing the acromioclavicular joint and the sternoclavicular joint. First is the piano key, finding the AC joint and the clavicle, and inferiorly pushing down to see if the AC joint translates compared bilaterally. The next would be the shear test, compression, seeing if there's pain or laxity in the AC joint. Next would be a cross-arm compression, going across the body, pressing in, should have pain or laxity. Next will be some rotator cuff test. The first will be a drop arm test. I'll just ask my patient to go ahead and abduct, thumb down, slowly move the arm down, drop. Positive test will be pain. The next will be the opposite, having the thumb down and having them press up for a Job's empty can test. My next one's going to be an infraspinatus test, having hand on the elbow, hand at the wrist, having my patient laterally rotating outwards against resistance. A positive test will be pain or laxity compared bilaterally. My next test is going to be a Ludington's test for the biceps tendon. I'm just going to ask my patient to cross their fingers over their head and flex. A positive sign we're not having a biceps tendon. Next test will be my near impingement test. Just having my patient go ahead. I'm going to passively elevate the arm up, immediately rotate. A positive sign would be pain compared bilaterally. The next one is a Hawkins-Kennedy. Just going to place the shoulder to 90 degrees, grabbing the elbow, immediately rotating it down. Positive sign would be pain or laxity compared bilaterally to the other shoulder. My next tests are going to be 3 for the slap lesion of the glenohumeral joint. My first is an anterior slide test. I'll just ask my patient to place his hand on his hip. And I'm just going to anteriorly translate the ball into the socket here. And then I'm going to ask him to resist me as well. Positive sign will be pain or laxity compared bilaterally. The next will be O'Brien's test. I'm going to ask him to stick his arms straight out for me, thumbs down, and then resist me. And then if he has pain with this, I'm going to go ahead and have him do the same thing, but turn the other way and resist. If the pain subsides, that is a positive test for the O'Brien's test. My last sign will be a sulcus sign. So I'm going to have my patient relax, hang the arm down. And then all you're going to do is stabilize at the top and pull down. A positive sign will be translation within that joint. And that's it.